China is supposedly modernizing and becoming a global superpower, but in other ways it still remains seriously medieval. Health officials there have just confirmed the fourth incident this month of plague, as in the plague that killed half of Europe in the Middle Ages. How does the plague spread, and is it heading here? Dr. Marc Siegel is a Fox medical contributor, and he joins us now. We're laughing about it, but the three big pandemics of the plague since the 14th century have all come from this part of the world.
And the reason for that, and we're not really laughing about this part, the Chinese government, even though they've created a Centers for Disease Control that's patterned after our own, where they literally track cases and they know who's sick, they don't know how to inform the world about this. They suppress it on social media. They delete their tweets where they say, hey, someone has the plague. They don't tell the World Health Organization for weeks. As you were mentioning, this led to an outbreak of a virus called SARS in 2003 that spread to over 30 countries. I'm worried about that happening with a plague. Now, they have checkpoints on the roads. Can you imagine you're driving along the road and they're stopping you to see if you have a plague, or you go to an airport and they're checking your temperature? It's spreading panic in China right now.
But isn't this something to do with their so-called one country, two systems things? Because as with SARS, and presumably it could happen with the plague, some guy in upcountry rural China eats the wrong marmot, and then his aunt goes to visit her cousin in Hong Kong, and one of them happens to be standing in the elevator at the Intercontinental, and the businessman who's staying there gets on a flight to Cape Town or New York or Paris, and that's how it spreads.
Exactly right, Mark. You could be working for the CDC. Let me tell you, it's a bacteria. And it lives in rodents, and rodents around the world still carry this bacteria, but unfortunately in parts of China they're eating it raw. Also, fleas on the surface of these varmints then spread it to humans. So fleas hopping from rats to humans. That's why it was so deadly in Europe, because they had a problem with all of the rats. Now, the Chinese government right now is trying to kill all the rodents and the fleas, and they're trying to control it that way, which is probably a good idea. But the fear worries me, because you know what happens when you get the plague if it isn't treated fast enough with antibiotics? It develops a lung form. Then pneumonic plague can spread by literally coughing it onto somebody. So
and has a much higher death rate.
Right, over 50%. And two of the people that have had it this month have had this version. If they got on a plane, God forbid, came to New York, you could see a case here.
Well, before anyone invented air travel, in the 19th century, the last big pandemic started killing members of the Chinese community in San Francisco. And Chester Arthur signed the Chinese Exclusion Act, which everyone thinks he did now just because he was a big, horrible white racist. But in fact, it was a health issue. And
Absolutely.
You get the feeling that would not be politically feasible at all today. So do we just have to trust to chance that nobody gets on that plane?
No, we need to be fighting this point, just as we're doing on the show here. It's not about, you know, one society versus another or the color of your skin. It's about the risk to public health. And when you see a disease reemerging, even 4 cases in a month is more than they ever have there. And we're going to see a lot more cases. We need to get the information out there. It needs to be at airports, and people need to be on the lookout. Fear spreads more disease than any virus and any bacteria.
Well, that's a cheerful note to end on for this Thanksgiving
weekend.
We're safe for now. Don't catch the plague before Monday.